Hello everyone and welcome back to Notes for Medicos. The topic that we're going to deal today is about histoplasmosis from microbiology, respiratory tract infection. So we'll be dealing with introduction, the pathogenesis, clinical features, lab diagnosis and treatment. So what is histoplasmosis? It is also known as Darling's disease. Its causative agent is Histoplasma capsulatum. So the transmission of this disease occurs via respiratory tract and the source is infected spores. So what happens over here is the infected spores, they get an entry via the respiratory tract and reaches the lungs. When they reaches the lungs, the macrophages present in the lungs, they attack these spores. But when this macrophages and phagocytosis occurs, so when this macrophages they ingest the spores doesn't die. They have the capability to resist the pathogenesis over there by some sort of mechanisms, and then they form yeast. This would be then discharged into the bloodstream. Once it's discharged in the bloodstream, it moves towards the lymph nodes, liver, spleen, adrenal glands, intestine, bone marrow, and it affects it. And it would be manifested as lymphadenopathy, hepatosplenomegaly, fever, anemia. Now, what are the clinical features? So you can see chronic pulmonary histoplasmosis, which means that there will be some pre-existing lung defect, for example, COPD, emphysema, or you can see chronic pneumonia or any other infection that would cause cavities, or there would be increase in the sputum. There would be chances of reactivation or reinfection and apical infection. For mediastinal granulomatosis, you would be seeing fibrosis, traction and occlusion of the mediastinal structure. For histoplasmoma, you would be seeing fibrosous nodule and concentric cessation and calcification. For skin lesions, it can either be ulcerative or granulomatous on the skin as well as on the mucous membrane. Now, what are the lab diagnoses? So, you'll be collecting a sample of blood, bone marrow. You can also take samples of the scrapings from the skin lesion and the biopsy of the lymph nodes. So, for the microscopy, you could do a GIMSA stain smear or right stain smear. When you would be looking at under the microscope, you can see oval, small intra or extracellular yeast having the size of 2 to 4 micrometer. Now for the culture, if you go for blood agar culture, you would be having to intubate it for 37 degrees Celsius. For in other cases, if you take STA, which is the most common culture used for histoplasmosis, SDA or other media, you would be seeing a white colony formation which would be cottony to look, and it would have some mycelial growth with thick and large layered of spores formation having tubercles. Tubercles means finger-like projections. Then we would be seeing the serodiagnosis. Serodiagnosis, you can take latex agglutination test, or you can go for complement fixation, or you can do precipitation. So the titers over here would be positive if it is greater than 1:8. For active histoplasmosis infections, the titer should be positive and greater to 1:32. Now we can do skin test too to find this out. So in skin test, what happens is we inject into the patient intradermally histoplasmin, which causes delayed hypersensitivity. So what is the treatment that we give to patients undergoing histoplasmosis? We would be giving them amphotericin B. So that was the video. I hope you like this video. If you like this video, don't forget to like, share and subscribe to our channel. We'll be coming with more videos. Still then stay tuned. Happy learning. This is Ashna Viraju signing off for today. Bye.